Hello, this is Siddharth Ambar from Chicago Arthritis and Regenerative Medicine. Welcome to our Monday live broadcast. So on this broadcast, I discuss common questions that I receive from patients about what we do here in the clinic, questions I get from my own office staff as well, and generally discussing concepts and ideas that are relevant to what we do here in clinic. We're focused on non-surgical treatment and management and evaluation of people with pain and dysfunction, specifically focusing on non-surgical treatment options for arthritis, tendonitis, injuries, and back pain. So I frequently talk about more and more about how metabolic syndrome is a problem for joints. So metabolic syndrome is a cluster of conditions that when they occur together, increase your risk of heart disease, stroke, and type 2 diabetes. So these cluster of conditions include elevated blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride or fatty content in the blood. It's significant because if you have metabolic syndrome, I frequently talk about how that makes you more prone to inflammation, which then makes you more prone to joint and tendon related problems. So how does that really translate in a practical manner, however? And do we have evidence that that can really affect arthritis? And it turns out, yes, we do. So a recent study published in the Indian Journal of Orthopaedics took a look at people that have knee osteoarthritis and took a look at this specific question about how on a biochemical level does metabolic syndrome affect knee osteoarthritis. So they took about 20 plus patients that have metabolic syndrome and knee osteoarthritis. They then took a matched cohort of people, 20 some people again, that have knee osteoarthritis and without metabolic syndrome. So matched cohort means that they were similar in age. They had roughly the same number of men and women and the same level of knee osteoarthritis. The main difference between these two groups was that you had one group that had metabolic syndrome and another group that did not have metabolic syndrome. And they essentially analyzed two different biochemical markers that you see in cartilage health. One is a biochemical marker of cartilage degeneration, and another is a biochemical marker of cartilage regeneration. And they found that between these two groups, one with metabolic syndrome, one without metabolic syndrome, both with knee osteoarthritis, that there is no difference in the level of cartilage regeneration biomarker. However, the degeneration biomarker was higher in the metabolic syndrome patients. That is interesting and significant. That level of cartilage breakdown marker was significantly higher and could suggest that that is why patients with metabolic syndrome can be more prone to osteoarthritic issues. This is interesting for a couple of reasons. Number one is it shows on a biochemical level how metabolic syndrome can be impacting cartilage health and joint health. So super relevant when we're talking about pain. Number two is, frequently we think of when it comes to treating your joints and tendons, your arthritis and tendonitis, we think of it as very much just a structural issue. We think of it as how do you improve the strength of the muscles? We also think of bones as very static tissue. That's not really accurate. These are dynamic processes, and they can get better and worse over time. And rather than think of arthritis and tendonitis in a static manner and as a really linear, two-dimensional physical process only, we should be thinking of it as an inflammatory process, as a biochemical process as well, and realize that there's other ways to treat these kind of issues. So when it comes to treating your knee health, you should be thinking about your nutrition and exercise, because it's not just about do you lose weight or maintaining an ideal body weight, but it's because on a biochemical level, metabolic syndrome makes you more likely to have cartilage breakdown. So we need to start thinking about nutrition, about not just weight loss, but how do we actually work on those risk factors for metabolic syndrome, whether it's blood sugar, whether it is blood pressure, whether it's the amount of fat around the waist, whether it's the amount of cholesterol as well, because those kind of risk factors do drive cartilage breakdown. And this particular study is really interesting because we need to start thinking about osteoarthritis progressively more and more as a biochemical process, as a biologic process, and not just as a structural process. Eventually, there is structural damage. But what drives that are biochemical and biologic processes at the level of the joint and at the level of throughout the body that you can actually work on with things like diet and supplements, things that actually work on some of those nuts and bolts of what drive metabolic syndrome. So really interesting study. And to me, it gives another angle about how we need to think about osteoarthritis and joint issues. And it also helps to explain why metabolic syndrome is a problem for people that have osteoarthritis, in particular the knee, but really osteoarthritis in general. So great. I think that kind of insight lets us help people in more ways, right? That we can think about how can we be preventative when it comes to knee osteoarthritis. Well, it's by working on some of those metabolic syndrome, biochemical sort of issues. Great. Well, I hope that was helpful and interesting to all of you. Until next time, and again, we do this live on Mondays and Wednesdays. If you have additional questions, shoot them my way or post them below. In addition, I'm doing a webinar this Wednesday at 5 p.m. Central Standard Time about regenerative medicine, and would love to see you there as well. Until next time, have a good day and live well. Bye-bye.